Mr. Chairman, I request permission to enter in a colloquy with Mr. Dix. Ranking Member Dix. Mr. Chairman, today I rise to address the Ranking Member of the House Appropriations Committee on Defense, Mr. Dix, and also the Chair, in a colloquy on the critical need to improve the recruitment, retention, and competitive compensation of the mental health professionals who can work with our wounded warriors, especially during the Iraq and Afghanistan military servicemen and women. Since 2001, 2,103 military members have died by suicide, and 1 in 5 service members currently suffer from post-traumatic stress and or major depression. We must ensure that an adequate number of mental health professionals are available to treat our soldiers. Mental health professionals must be retained by providing adequate pay and competitive benefits that are also available in the private sector. It is our duty and responsibility to our wounded warriors that we ensure their mental health services are secure and available when and where needed. I'm submitting for the record an article from the Army Times dated April 7, 2011 regarding the Senate Appropriations Committee Defense Subcommittee meeting of April 6th, quoting Army Surgeon General Lieutenant General Schumacher, who stressed severe lack of mental health professionals in the military and his concern about retention, especially in the rural areas. His quote also states, Congress has been pressing the military health system to add more psychiatric doctors, nurses, and social workers for years. That has prompted the services to add about 1,500 full-time mental health professionals since 2006, a 70% increase. He further says, but demand has continued to outpace the growth. Active duty troops and their families were referred to off-base civilian mental health care professionals nearly 4 million times. 4 million times in 2009, roughly double the number of off-base referrals in 2006, the military data shows. The dramatic increase in military suicides during the past several years has added urgency to congressional concerns. At the April 6th hearing, all 3 military surgeons generals told lawmakers about efforts to improve training, recruiting, and retention of mental health professionals. Senator Mikulski has suggested military training may be uniquely important because some civilian doctors and social workers have trouble understanding the troops' problems and mindset. I'm also submitting for the record a witness statement of July 14, 2011 from the Subcommittee of Oversight and Investigations on Veterans Affairs, where Deputy Director of Veterans Affairs and Rehabilitation Division, Jacob God, expressed the challenges of hiring and retaining quality mental health specialists. Our service members should not have to wait one more day for the help they deserve. As co-chair of the Congressional Mental Health Caucus, I have met with many key military leaders to learn what the most critical issues are in addressing mental health services for our military men and women. I've repeatedly been informed that there have been woefully inadequate numbers of mental health professionals available to care for our men and women. Congress has a responsibility to see that our soldiers and veterans have the resources for quality care. Because this quality of care is dependent on the quantity of behavioral health specialists trained in war, PTS, we must successfully recruit and retain to work with our men and women who fight to ensure our precious daily freedoms. The legislation before you today provides $32.3 billion for the Defense Health Program and Military Family Programs, with $125 million of this going towards research of traumatic brain injury and psychological health treatment, hopefully to also include hyperbaric treatment research. We must insist on accountability that adequately trained behavioral health professionals are on hand when and where needed. I'd like to work with the ranking member to obtain from the Department of Defense a detailed outline on their efforts for each military service, Army, Air Force, Navy, Marines, etc., to recruit, retain, and formulate the competitive salaries and benefits that will keep behavioral health specialists serving our men and women who have given so much to protect our freedoms. We place them in harm's way. It is our duty and obligation to ensure best care is given to them. Now yield to Ranking Member Mr. Dix.
I will work with the gentlelady on the Defense Department's plan to ensure adequate mental health services for our I ask for one more minute.
Is there
unanimous
objection?
consent?
No objection. The gentlelady is recognized for one more minute.
The gentlelady would continue to yield.
Yes, sir.
Mental health services for our service members. And I would point out that the chairman of this committee, Mr. Young, and his wife Beverly have been some of the strongest advocates for our wounded warriors and has led the fight in our committee to increase the funding for traumatic brain injury and post-traumatic stress disorder. So our committee has been very committed to this. It's one of our highest priorities.
I thank Mr. Dix and the ranking member for working with me on this critical issue and look forward to working soon enough on this. Yield back.
Gentlelady yields back her time.